Hello and a very warm welcome to the CNN IBN special. 60 lakh children are affected by pneumonia every year and nearly 4 lakh die because of the disease. On World Pneumonia Day, we look at the reasons and possible solutions to reduce the menace that so many young lives. With me in the studio, Dr. N.K. Arora, former AIIMS Professor of Pediatrics and Executive Director of INCLEN Trust, Professor N.K. Ganguly, former Director General ICMR and currently the President of JIPMER and Asian Institute of Public Health, and public health expert Dr. Ajay Khera, who is also the Deputy Commissioner at the Ministry of Health. Thanks for joining us, gentlemen. Professor Ganguly, let me start with you first. The stats are startling. Every 4 minutes, a child is dying of pneumonia-related diseases. Where are we going wrong? Are we taking this too lightly? Have we taken pneumonia too lightly?
No, we haven't taken pneumonia too lightly. This is a part of the MDG 4, that is saving the infants and children. And we have major program for pneumonia, reaching people at their doorsteps to take care of pneumonia and septicemia. However, the problem is enormous. The Indian problem is that the health systems have just got revised in the form of the National Rural Health Mission. Urban Health Mission is still to get into shape. In another 4 or 5 years, we might be able to introduce the most vaccine-related areas.
Yeah, that is what my second question to you, sir, is. We are talking about vaccines. We are also talking about treatment plans. What are the kind of vaccines that are available?
For pneumonia, there are now several vaccines are available, and in recent times, a lot of research has gone into it. So there are broadly two categories: bacterial vaccines, and for which we have a vaccine called Hib vaccine. Fortunately, introduction of this vaccine has already started in this country. And the other is pneumococcal vaccine, or which we also call PCV vaccines. So these are two bacterial vaccines. And for viruses, influenza vaccine is available, which also is an important cause of pneumonia. And so these are three main vaccines for it.
Dr. Ganguly, we spoke about Hib vaccine and PCV vaccine, as Dr. Arora is suggesting. What is the difference? What is the primary difference between the two?
The Hib and strep pneumoniae are the two major etiologic agents for bacterial pneumonia, as Dr. Arora said. The Hib is caused by the H. flu B, and there are not many strain variations over there. The strep pneumoniae, they are actually categorized according to the carbohydrate on their surface, and there are about 100 different varieties according to carbohydrate in the strep pneumoniae. So strep pneumoniae is essentially a multivalent vaccines. So these are the two major differences, but these two combine the majority of the pneumonia and meningitis cases which are happening in our country.
Dr. Khera, that brings me to you. PCV, as we are talking about, is being used in 85 countries now, mostly the low-income countries, and also UK in its childhood immunization program has it. Closer home, Pakistan has it included in its immunization program. How long before we include it in our immunization health programs, and do you see an immediate need for it?
We are not averse to the vaccine. The only thing is we need to have adequate evidence, and we are trying to generate the India-specific evidence. And once the India-specific evidence is available, then the government of India will like to make use of the vaccines as a strategy.
Professor Ganguly, why is it important that the government introduces the pneumonia vaccine in its universal immunization health support system?
It is important because case management will ultimately succeed for certain percentage, and certain percentage might escape the healthcare. And the nutrition, etc., have been perpetual problems staying with us for last 50 years, and we are struggling the same way as we are struggling for pure water, good air, and good housing, etc. So vaccine becomes very, very important component of that, because in vaccine, if you are able to reach, as the government of India is trying to reach, at least 80 to 90% of children who need vaccine. If we have a PCV vaccine and Hib vaccine, and if we could deliver them, it will be a tremendous help in quickly attaining the MDG goal 4. However, while we are not able to do that, we need to take care of the children at their home so that they survive and they get the appropriate health care and build up their nutrition so that they are able to fight the infection better.
Dr. Arora, you were making a point.
Yeah, I want to, I think why vaccines are so important. Case management is important, but simultaneously and equally important is the access. And it is also important to look at the factors and also the population segment which gets maximally affected. It's basically the lower 1/3 of the population, socially lower 1/3 and the economically lower 1/3, where the disease load is maximum, where mortality is maximum, and who have least access to our public health system. And if anybody gets sick, the whole economics get derailed in this segment. And it who are likely to benefit from any vaccination program. It prevents illness, it prevents all illness associated expenditures, and it also prevents death because malnutrition is also maximum. Therefore, it is imperative that these vaccines are introduced, and also the focus is on that lower 1/3 of the segment who are at highest risk of both death and disease.
Dr. Khera, that brings me to you. Critics say that India's infrastructure when it comes to immunization system is not ready to incorporate new vaccines. How correct is that? And if you have to include it in the system, if you have to improve upon the system, what is the government doing to do that?
You know, regarding immunization, as you must be knowing, the available data sets,
right,
which I am quoting for the year 2009, which were the evaluated survey, which shows around 61% of children get completely immunized. So that means rest of the 40% children either are not immunized or partially immunized. So there is a problem. You know, considering this problem, the government of India declared this year 2012-13 as the year of intensification. And you know, there is a kind of a large investment is happening in terms of strengthening the routine immunization system in the country. So there are efforts in that direction in terms of strengthening and improving the routine immunization system. And once that system, gets improved, we'll be able to add new vaccines.
Let me take a quick break here. So time now for a quick break, but when we come back, we take your questions from our eminent panelists, so stay with us.